for today's webinar. Our environment is just to spread awareness about rabies, which is fatal but can avoidable once appropriate vaccination. This is the initiative for the Cadila Pharma. Truly, it's innovative for the serve the society and humankind. The topic of the webinar, the dosage reduce strategy in the rabies management. Role of novel vaccination. Dear doctor, rabies is the world's first novel 3-dose anti-rabies vaccine and with greater pride. We would like to inform you that rabies has successfully completed 1 year of launch with more than 40,000 animal bite vaccine victim with vaccinated 100% compliance from recorded and no case of adults was registered. With this, it is my honor to introduce you to a speaker today webinar, Dr. Amit Vasu, is the MD physician. It is total experience is the 11 years. Out of 11 years, 9 years is the practicing in the Bangalore hospital and 2 years United Hospital, Jayanagar. So now I would like to request you, Dr. Amit Vasu, to initiate the talk, and later on we have two question answer session. All the participants can drop the question in the drop box and we all read and the question answer, and we have the box and we will ready to pull all the question after the presentation. Start. So now, now I would like to request you to Dr. Amit Basu to introduce initiate the talk, and later we have to question answer session. All the participants can drop the question in this drop box, and we will read out all the question after the presentation. Thank you. Over to you, Doctor.
Yeah, thank you, sir. And I would like to thank Cadila for giving me this opportunity to speak on this forum. Thank you so much. So I will just start. I will try to keep my session easy and brief. So yeah, it's okay. Like, it will be easy for everyone to follow, and we'll have a short discussion on rabies. Rabies, as we all know, it is basically a preventable viral infection. It is a preventable viral infection which infects the central nervous system mainly and causes diseases in the brain. If not treated, it is a 100% fatal disease actually. Rabies. It is primarily transmitted from the rabid animal's saliva when it bites or scratches someone. It can also happen when there is a lick, when the wounds are licked by the infected animals or grazed, or from a broken skin, or to the lining of the mouth or nose, can also transmit the disease. Dogs are responsible for almost 96% of these of the rabies infection. Yeah, it is actually a public health challenge in India. Globally, almost 59,000 human deaths annually. Highest, most of them are in India. India had almost 20,000 human deaths per year from rabies, accounting for 60% of the rabies deaths in Asia and 35% globally. Out of these, 91% of the deaths that has happened in India has taken place in the rural areas. Rural areas. It is said that every 9 minutes a person is dying from rabies in India. Yeah, India and like they say in India is home to an estimated of more than 60 million stray dogs and 25 to 30 million pet dogs. The WHO report on rabies in 2018 estimated that India had 20,000 human deaths a year from rabies, accounting for 60% of the rabies deaths in Asia and 35% globally. Out of these, almost like one third were found from one third of all the rabies deaths were from Uttar Pradesh, and nearly three quarters, that is 8,900, were in 7 central and southeastern states. That is Chhattisgarh, Uttar Pradesh, Orissa, Andhra Pradesh, Bihar, Assam, and Madhya Pradesh. Among largest states, the highest rates of rabies deaths were in Chhattisgarh, Uttar Pradesh, and Orissa. No rabies deaths were reported in the study areas from the following states, that is Kerala, Jammu and Kashmir, Jharkhand, Manipur, Meghalaya, Nagaland, Sikkim, Mizoram, Andaman and Nicobar Islands, Lakshadweep, Chandigarh, Dadra Nagar Haveli, and Daman and Diu. Now coming to a brief on the current management protocols that we have right now. The first thing in the management involves so now coming to the current management of rabies that we follow normally. First includes first aid. First aid has local wound treatment. Local wound treatment is mainly, it happens immediately when a person is bitten by the wild animal or the animal, mainly dog. Wound should be washed and flushed immediately as a part of the first aid with soap and water for around 10 to 15 minutes. If soap is not available, flush with water alone can be done. This is the most effective first aid therapy that we have. Then it should be cleaned with 70% ethanol or betadine solution if available. Then as soon as possible, the person has to be taken to a health center for the vaccine. That is active immunization. Active immunization and passive immunization is mainly immunoglobulins. Okay, so the most common active for category 2 and 3 wounds, the most common the most common regimen that we have now for the vaccine is 5 doses on day 0, that is on the day of the bite, day 0, day 3, day 7, day 14, and day 28. This is the most common. This is the regime that is being followed right now. It is mostly administered intramuscular in the deltoid region, that is in the upper arm or the anterior lateral aspect of the thigh only, and it's not given in the gluteal region usually. Current challenges that we face in the post-exposure prophylaxis is non-compliance. That is the most common challenge that we face. The current rabies vaccine that we have are cell culture vaccines. Inactivated vaccines are more than 50 year old in technology. They are inconsistency and most common challenges that we face for those vaccines are inconsistency in potency, stability, availability, that there may be a short supply or adverse events. Coming to the compliance in anti-rabies vaccine, who received all those patients with the dog bite who has received the full course of ARV, that is the scheduled doses of ARV on the recommended dates. Delayed compliance are those who completed the scheduled dose of ARV within 60 days but deviated from the scheduled regimen. Dropout or non-compliant are those who had taken at least one dose of ARV after animal bite but not completed all the scheduled doses. Non-compliance to 5 dose. This is just a study. These are just case scenarios, just to show non-compliance to 5 dose and where the patient has actually died, leading to non-compliance because of non-compliance for any reason, non-compliance to the treatment, to the post-exposure prophylaxis, leading to death of the patient. So the first patient that we see is a 50-year-old female. She was who was bitten by a stray dog, which was killed soon. She had taken 3 doses of Rabipur vaccine, 037 dose. She had not taken the dose on 14th and on the day 14th and 28th, and she had not taken the rabies immunoglobulin also. It was a category 3 dog bite on the right side of the nose, that is on the face. Okay, and then she developed paresthesia on the face for 20 days, fever and restlessness, altered sensorium for 5 days. CSF was done, which showed total cells 5 monomorphs, 100%, protein of 126, sugar of 71, negative staining. Rabies, the diagnosis was made as rabies encephalitis. So rising serum and CSF viral neutralizing antibody titer of okay. So the patient died actually. Hospital survival of 16 days, but died after 1 day due to llama. Yeah. This is an original article from Safdarjung Hospital in New Delhi. It shows the compliance of post-exposure prophylaxis among animal bite patients. This is a hospital-based epidemiological study where the sample size was 360. Animal bite patient. In this study, it was shown that 53% were non-compliant to the full course of ARV. 53% in a government hospital, it's very high actually. This is also a research article to show the compliance to anti-rabies vaccination in post-exposure prophylaxis at municipal corporation hospitals in Bangalore. The sample size was 215 animal bite patients. 1 dose of rabies vaccine administered intramuscular on days 0, 3, 7, 14, and 28 as PEP. Also measures the constraints for compliance to complete course. The compliance rate for intramuscular vaccine rate was 60%, which is more or less similar to the study in Delhi. Constraints for compliance to complete course of anti-rabies vaccine. The most common ways of non-compliance would be forgotten dates is very common. Cost incurred maybe for traveling or for the vaccine itself. Distance traveling, that is another cause of non-compliance. For kids, it may be interference with the school timings, and for adults, most common or the most important cause is loss of wages. Evaluation of the rabies vaccine. Non-compliance led to evaluation in treatment regime from 31 dose to 5 dose and still on. Nervous tissue vaccines were started in 1885 as a live attenuated vaccine, and then it shifted to an inactivated vaccine in 1911. Then the cell culture vaccine, the 5-dose vaccine, was started in 1976. Yeah. So now coming to today's most important topic is meeting the unmet medical need, that is introducing a novel vaccine with a simpler and a shorter regimen as compared to the present regimen that we are using right now. This is a 3-dose vaccine, novel 3-dose recombinant rabies G protein vaccine. It is prepared from VLP platform technology, which is a very modern technology. First dose, this is the first vaccine with a 3-dose intramuscular regimen, that is on days 0, 3, and 7. It is very good and compliant due to its easy and flow regimen and less number of visits. It is convenient to use. Yeah, it is convenient, ready to use. No reconstitution is required. It is the first protein subunit vaccine that has been found. Very novel. It's a novel 3-dose recombinant rabies G protein vaccine. It's also available as the Travis. It's called Travis right now, the latest one which is launched. So coming to this VLP technology on how it is formed from the native virus, G protein isolation is done, which is purified and stabilized in the lab by Cadila Pharmaceuticals. So these virus-like particles or protein complexes exist as nanoparticles, which are very similar to the native viral particles but do not contain the viral genome. They cannot replicate but can mimic the viral antigenicity without being pathogenic. They are capable of inducing a strong humoral and cellular immune response. Here is a study, which was published in this journal called Human Vaccine and Immunotherapeutics, where it was studied on the safety and immunogenicity of this 3-dose vaccine, of this particular 3-dose vaccine. And it was established that out of in this sample size of 800 patients, it was done to evaluate the immunogenicity and safety of these vaccines when initiated as a post-exposure prophylaxis in healthy volunteers. It was a randomized multicentric study. Yeah. So the results, which were consistent across different age groups and genders, the observed difference was 1.52% with the specified margin of -4%. The primary endpoint were day 14 and day 42 were met. Test and comparative are indicated in seroprotection rate both on day 14 and day 42. It was proved that it has a better safety profile and significant less adverse effect as compared to the normal and the regular regimen that we are using right now. Yeah. Seroprotection for this particular brand, that was Travis, which was used in this study, on the day 14 was 99.24% as compared to the 97.72% seroprotection for the regular 5-day regimen. And seroprotection on 42nd day was also fairly good at almost 98.7%. Safety-wise, localized pain was much less at 7.69% for this particular 3-day vaccine Travis, compared to the localized pain of 13.5%. Redness was also less at 2.5% compared to the regular regimen. Swelling was less at 0.7% compared to the regular regimen. Systemic side effects like fever, ear pain, headache, urticaria, joint pain were also significantly less as compared to the normal regimen that is being used now. So in short, the conclusion is like this 3-dose novel vaccine is definitely non-inferior to the reference vaccine. It has much less side effects, systemic and systemic and local side effects compared to the regular vaccine. It's found to be safe and immunogenic and was comparable to the 5 doses of WHO pre-qualified vaccine. And it is actually this vaccine has also been awarded the Pharma Innovation of the Year for this year. And also in Malaysia for this innovative finding, like reducing the number of days from 5 doses to 3 doses. It has been a wonderful innovation actually, and I hope and I wish Cadel all the best for this new vaccine. Thank you.
Thank you, sir.
Yeah.
Thank you, sir, for giving this wonderful talk, sir. And here, sir, your the participant side one question it came, sir. So, what is the rabies and how is the rabies transmitted? So,
Rabies is actually a preventable viral disease which is transmitted mainly by the infected rabid animal. 96% of times it is a dog, a rabid dog. It is a disease which infects mainly the CNS, central nervous system, and causes diseases in the brain. It is almost 100% fatal, 100% fatal viral infection. Yes. How is it transmitted? It is transmitted mainly by the infected saliva of the infected animal. Saliva of the infected animal, and also by leaks on the open wound leaks, or any lining of the mucosal lining in the mouth, nose, or anywhere in the body can also transmit the disease.
okay, sir. Okay, sir. And sir, one more question is there. So, like any limitation of the vaccination dose, sir, for the any benefit for the 3 dose, or what is the benefit of the 5 dose? So, both which are the best?
The benefit of 3 doses. The benefit of 3 doses is the number of times the patient has to take the vaccine, and number of times patient has to come to the hospital is only 3 times compared to 5 times. And like we already saw regarding this side effects are also very less. Localized and systemic side effects of this 3-dose vaccine compared to the regular vaccine is very less. Both the localized and systemic side effects are less. Like systemic includes fever, pain, headache, urticaria, itching, joint pains. All those things are less. Localized maybe localized pain, redness, swelling. Those incidences are also less as compared to the regular vaccine. And compared to the seroprotection levels, it's almost comparable. Almost comparable on day 14th, and both the regimens are comparable on day 14 and day 42. That is the study which was done in this study. And non-compliance is also less. The incidence of non-compliance for a 3-dose regimen will be obviously less compared to a 5-dose regimen, because it is more feasible. Less number of injections, less number of traveling, all those things.
So within a week, our dose they are going to complete it, sir. So patient they can't cover like 1 month. They not able to come for the hospital, sir. This is a benefit for the patient also, sir.
Yeah, it is beneficial to the patient. Definitely beneficial.
Yes, sir. Yes, sir. Yes, sir. Yes, sir. Correct, sir. Okay, sir. Thank you, sir.
Thank you.
Okay, sir. So thank you so much to Dr. Amit Basu for the informative talk. We are truly appreciate for your effort. Last but not the least, we would like to inform you that Travis was two-part prestigious award in weighted category. One is the ET India Pharma World Award, and second one is the Golden Tiger Awards. So thank you, sir. Thank you for the giving for your precious time, sir. Thank you.
Thank you so much.
Thank you, sir.
Thank you.